Welcome to Have More Babies. Today we're diving into something I think many parents listening have probably dealt with or worried about, strep throat in kids.
Oh, absolutely. It's so common, isn't it? You know that feeling a child says, my throat hurts, and your mind just instantly jumps to, could it be strep?
Exactly. We've all been there. That sudden complaint, and you're hoping, maybe praying. It's just, a simple cold.
But that little worry about strep is always there.
Right. We want to know what we're actually facing, and more importantly, when it's time to get, well, properly concerned.
And that's precisely our aim today. We're drawing on some great material from Omega Pediatrics to help understand this.
Okay.
Because the thing is, while strep throat often looks like just another sore throat, it carries this potential for seriousness that we really need to be aware of.
Right.
It's not usually the strep infection itself that's invasive, but the complications. Those are the real reason for paying close attention.
Complications. Okay.
Yeah, and just to put it in perspective, the CDC notes around 1,100 to 1,600 deaths each year from invasive group A strep disease. Now, again, strep throat itself isn't invasive like that, but it highlights why the underlying bacteria needs respect.
Okay, that definitely gets your attention. So let's start with the basics then. What exactly is strep throat?
Well, simply put, it's an infection. It happens in the throat, sometimes the tonsils too,
Okay.
and it's caused by a specific kind of bacteria. You might hear it called streptococcus pyogenes, or more commonly, group A strep.
Group A strep. Got it. And it spreads easily, I take it.
Oh, very easily. That's a key thing about it. It's highly contagious.
Which with kids means trouble.
Exactly. They're great at sharing everything, including germs.
So how does it actually pass around? What are we looking at?
It's mostly through, close person-to-person contact.
Mm-hmm.
Think about the usual kid stuff.
Coughing, sneezing.
Definitely coughing and sneezing.
Yeah,
Little droplets flying around. It's also sharing things like food utensils, cups, drinks.
right.
Even just being close, talking if someone's infected, can sometimes be enough to transmit the bacteria.
Makes sense. So, okay, my kid wakes up, mom, dad, my throat hurts. How do I start figuring out if this might be strep versus just, a regular sore throat from a virus?
That's the million-dollar question, isn't it? Because, like you said, the symptoms can really overlap.
Yeah.
But with strep throat, you often see a very abrupt start. Like they were fine yesterday, and bam, today it really hurts, especially painful swallowing.
Okay, sudden onset, painful swallowing. What else?
You might also notice their lymph nodes, the glands in their neck.
Yeah,
They can be quite swollen and tender if you gently press there.
right. I've felt those before. But, you can get swollen glands with a cold, too, sometimes.
True, true. That's why you look for a cluster of symptoms. Something more specific you might actually see with strep.
See, like looking in their throat.
Exactly. If you can get a peek back there, sometimes you'll see white or yellowish spots or kind of streaks on the tonsils or the back of the throat. Those are called exudates.
Exudates. Okay, white spots.
Yeah. And sometimes tiny little red spots on the roof of the mouth, too. Plus, fever is usually part of the picture with strep.
Fever. Okay. Are there any other, maybe less common signs that could point towards strep?
Well, sometimes a skin rash can pop up. It often feels a bit like sandpaper.
A rash.
Yeah, that's actually a sign of scarlet fever, which is basically strep throat with a rash. It's caused by the same bacteria.
Oh, interesting. Scarlet fever.
Mm-hmm. Also, consider exposure. Has anyone else in the family, or maybe at school or daycare, had strep recently? That definitely bumps up the suspicion.
Good point. Context matters.
Absolutely. And then you might see other general symptoms like headache, body aches,
Hmm.
and especially younger kids, sometimes nausea or even vomiting can happen with strep.
Nausea and vomiting. Wow. Okay.
Yeah, it's more common in the little ones. It's also worth noting, while adults can get strep, kids are just much more likely to pick it up because they're in such close contact all the time at school and play.
Right. Daycares, schools,
Mhm.
petri dishes sometimes.
Kind of. Even though we often hear more about complications in adults, kids get the infection more frequently.
So it sounds like figuring out if it's bacterial, like strep, or viral is really, really important because of those complications you mentioned earlier.
Absolutely critical. Because antibiotics work for strep, but they do nothing for viruses.
Mm-hmm.
And avoiding those complications is the main goal of treatment.
Okay, so let's talk about those complications. What are we actually worried about here?
We can sort of divide them into two main groups. First, you have complications that happen because the strep infection itself spreads beyond the throat.
Like where?
It can spread to the ears, causing middle ear infections, otitis media.
Okay.
It can form an abscess, like a collection of pus, around the tonsils. That's called a peritonsillar abscess. Very painful.
Ouch.
It can lead to sinusitis, an infection of the sinuses.
Yeah.
In rarer, more serious cases, things like toxic shock syndrome or even an abscess deeper in the neck called a retropharyngeal abscess.
Wow.
And infected lymph nodes, too, lymphadenitis. So that's one category of the infection spreading.
Okay, now that sounds good. What's the second category?
The second group is a bit different. It's not the bacteria spreading, but rather the body's own immune system reacting, kind of overreacting, after the strep infection.
An immune response issue.
Exactly.
Hmm.
This is where things like scarlet fever, with that rash we mentioned, fit in. Also something called glomerulonephritis.
Glomerular what?
Glomerulonephritis, it's inflammation in the kidneys.
Hmm.
And the worry there is it can potentially lead to chronic kidney problems later on.
Kidney problems from a sore throat. That's unexpected.
It is, but it can happen. There's also something called PANDAS. It's an acronym.
Pandichias, like the bear.
Sort of.
Hmm.
It stands for Pediatric Autoimmune Neuropsychiatric Disorders associated with streptococcal infections. It involves sudden onset of things like OCD or tics after a strep infection in some kids.
Oh, wow. Okay.
And then the one that probably rings the most alarm bells for people, rheumatic fever.
Yes, rheumatic fever. I've definitely heard about that one. That's a really serious one, right?
It is very serious. Rheumatic fever is an inflammatory condition that can cause damage to the heart valves, affect the joints, the brain, the skin. It can have lifelong consequences.
Heart damage. Yeah.
So you see, whether it's the infection spreading directly or these later immune reactions, the potential fallout from untreated strep can be severe, sometimes even life-threatening, and can lead to chronic health issues. That's why we don't just shrug off a sore throat in a child, especially if strep seems possible.
Okay, message received loud and clear. Strep is definitely not something to ignore. So, practically speaking, what should parents do if they suspect their child might have it?
The absolute #1 rule is, when in doubt, make that call. See your doctor or pediatrician. Don't hesitate.
Okay, call the doctor. What about while waiting for the appointment? Anything to do at home?
Yeah, focus on comfort and hydration. Make sure your child is drinking plenty of fluids. Water, diluted juice, popsicles can feel good on a sore throat.
Right, hydration's always key.
Absolutely. And you can give them over-the-counter pain relievers, like ibuprofen, following the dosage instructions, of course. That helps with both the throat pain and any fever they might have.
Ibuprofen for pain and fever. Got it. Then it's off to the clinic.
Yes. Ideally, you want to get them tested. The standard is a rapid strep test. It's a quick throat swab.
Okay.
And, thinking about when these things happen, often it's evenings or weekends, right?
Always. Murphy's Law of Parenting.
Exactly. That's where places like Omega Pediatrics really try to help. They actually have extended weekday hours. They take walk-ins until 9 p.m. at their Roswell, Georgia location.
9 p.m. Wow, that's late. That's fantastic for working parents.
It really is a huge help. And for patients they already know, they also offer telemedicine, e-visits, which could be super convenient too.
So, if someone listening can't get to Omega Pediatrics, what's the alternative?
An urgent care center is usually a good bet. They can typically do the rapid strep test and prescribe antibiotics if it comes back positive.
Okay. And antibiotics are the standard treatment if it is strep.
Yes, if the test confirms strep, antibiotics are necessary to kill the bacteria, help symptoms improve faster, and most importantly, prevent those serious complications like rheumatic fever.
Right.
But it's also important to know if the doctor thinks it's more likely a virus based on the symptoms and maybe the test is negative, they won't prescribe antibiotics.
And it shouldn't.
Shouldn't.
Because they don't work on viruses.
Exactly.
Yeah.
We need to use antibiotics wisely. If strep is diagnosed, it's usually a course of oral antibiotics like penicillin or amoxicillin. Sometimes, in certain situations, an injection might be an option too.
Okay.
Doctors actually use clinical scoring systems sometimes. There's one developed back in 1998 to help them gauge the likelihood of strep based on symptoms, which helps guide testing and treatment decisions.
It sounds like there's a lot of thought behind it, not just handing out antibiotics. You mentioned Omega Pediatrics and their approach to making care easier for parents.
Yeah, they really emphasize what they call the Omega Pediatrics difference. It's built around that accessibility, the extended hours we talked about, the telemedicine options, basically making it less stressful for parents to get care when their child needs it, not just during standard 9 to 5 hours.
And where are they located again?
They have clinics in both Roswell and Alpharetta. So they serve a pretty wide area, North Fulton County, and also surrounding cities like Sandy Springs, Johns Creek, Duluth, even up towards Cumming.
That's convenient for a lot of folks in that area. And is it just for sick visits like strep, or do they offer other things too?
Oh, much more. A really key benefit is that they also offer after-hours immunizations, and preventive health services.
After hours immunizations, that's huge. Trying to fit those into a workday schedule can be tough.
It really can.
Yeah.
So offering that flexibility for essential things like vaccines and checkups alongside the sick care shows a real commitment to, comprehensive and parent-friendly pediatric care.
That all sounds incredibly helpful. So for anyone listening who wants to learn more, maybe read up specifically on strep throat or find details about Omega Pediatric Services, where should they go?
The best place is definitely their website. It has detailed information. Just visit omegapediatrics.com.
Okay.
You can find specifics about strep, their clinic locations, those extended hours, the services they offer.
Mhm.
It's all there. omegapediatrics.com.
Great. So as you navigate all the coughs, sniffles, and inevitable sore throats that come with raising kids, hopefully what we've talked about today gives you a clearer picture of strep throat.
Yeah, common, yes, but something to take seriously.
Exactly. And for more really solid information and resources on children's health, please do check out omegapediatrics.com.
Definitely worth a visit.
And hey, if you found this conversation useful today, we'd really appreciate it if you'd like this video, subscribe to our channel for more discussions like this one.
And maybe share with other parents, it might help them out too.
Absolutely. Thanks so much for tuning in to Have More Babies.
Stay healthy, stay informed, and we'll talk to you next time.
Bye, everyone.